And we remain in South Africa. The country is hosting the 21st AIDS conference, as we mentioned. Observers say there have been some progress in the country's efforts to address the AIDS epidemic, but challenges remain in the country as well as globally. A report released ahead of the 21st International AIDS Conference says while new HIV infections had fallen dramatically over the past 2 decades, especially among children, the trend among adults has stalled and even risen in a number of places in the past 5 years. Michel Sidibe is Executive Director of UNAIDS, the joint UN program on HIV/AIDS.
Key population still don't have access to HIV prevention services. Gay men and other men who have sex with men, sex workers and their clients, transgender people, people who inject drugs, and prisoners account for 35% of all new infections amongst adults.
The UNAIDS report found that an estimated 17 million patients are on treatment worldwide and less than half of those diagnosed as HIV positive.
We need to achieve 90% of people living with HIV who know their status, and 90% of the people who know their status on treatment if they are positive, and 90% of people on treatment with suppressed viral loads.
In South Africa, statistics show that about 7 million South Africans currently live with HIV. This represents 19% of the adult population. Girls and young women between 15 and 24 are the most vulnerable to infection. South African Health Minister Aaron Motsoaledi.
It's worrying, and that's why in South Africa, because half of those infections are in South Africa, just in that age group. That's why we had to launch a special program for them. So our worry is that age group, not the rest of the population. In the rest of the population is actually going down.
While Motsoaledi vows to have a generation under 20 who are free of HIV/AIDS by 2030, experts say AIDS cannot be tackled properly until the underlying socioeconomic issues are addressed, especially with women.
If you are not empowered as a female to look after yourself, in a lot of times, even though it's not said like openly, you find yourself to say, if I am dependent on this man, therefore I cannot be able to challenge this man.
At the epicenter of the worldwide AIDS pandemic, South Africa now boasts the largest treatment program in the world. 3.4 million people are receiving the antiretroviral drugs that allow those living with HIV to lead normal lives.